My name is Savyasachi Thakkar. I'm an orthopedic surgeon at Johns Hopkins. I specialize in hip and knee reconstruction. I work at the Howard County General Hospital. The causes of hip replacement surgery are arthritis, fractures around the hip joint, and cancerous lesions around the hip joint. Planning a hip replacement or knee replacement surgery involves careful coordination of several different aspects of a patient's healthcare. At Johns Hopkins Orthopedics, we specialize in creating a pathway for each individual patient and trying to achieve the best possible outcome for their care. We would start by activity and lifestyle modifications, such as stopping smoking, healthy weight loss standards, to try and optimize patients for surgery. Once they undergo surgery, we have a carefully coordinated team of nurses, physical therapists, occupational therapists, and the patient's surgeon who overlook every single aspect of the patient's care protocol. Prehab or prehabilitation is physical therapy and exercise regimen before the surgical intervention so that patients can bounce back and recover from their surgical procedure with minimal downtime. At Johns Hopkins Orthopedics, in conjunction with our physical therapists at the Musculoskeletal Center in Columbia, we specialize in prehabilitation exercise regimens for our patients that are preparing to undergo surgery so that they can be back at work and back at their sport activities without any interruption. A hip joint is a ball and socket joint. When we replace a joint, we replace it with another ball and socket, which makes it a lot easier for patients to recover from the surgery. Typically, patients who undergo hip replacement surgery from any approach, be it the anterior approach, the anterolateral approach, or the posterolateral approach, go home the same day after surgery and recover within 2 to 4 weeks after the procedure. We believe in multimodal pain control. We do not rely on just one agent, but we have a combination of agents such as anti-inflammatories, nerve-related medications, opioids, nerve blocks to help patients recover faster from their procedures and to also try and achieve pain control before these procedures. At Johns Hopkins Orthopedics, in conjunction with the physical therapists at the Musculoskeletal Center in Columbia, we specialize in caring for patients after hip replacement surgery. We typically employ activities such as the zero-gravity treadmill, the anti-gravity treadmill. We also specialize in water-based exercises or aqua therapy in order to achieve better outcomes while providing less pressure to the joint. A growing concern that patients have is metal allergy, especially allergy to the implants that we use in hip and knee procedures. In the hip, the metal is titanium and patients are not allergic to titanium. Typically, patients wonder if they would set off metal detectors at airports. I like to tell them that given the amount of titanium that's in a total hip or a total knee joint, it's very likely that they would set off that metal detector. In that situation, I like to give them the operative record so they can show that to the TSA official and undergo the pat-down lane to safely proceed to their destination.